What do you do if you have pain in your left arm and left leg, or your right arm and right leg for that matter? I got a recent question on a YouTube video, and I thought this would be a really good chance to answer that question because it's a scary one and one that many people won't get a straightforward answer to at their local medical doctor or anywhere else on the internet. Now, just a brief disclaimer before I read this to anyone who may be watching this, including the person who asked the question. Do not use this in place of actual medical advice. If you're getting pain in your hand and leg, do get it checked out because there are some serious central nervous system disorders, such as multiple sclerosis, for example, that can cause those things. But if you've done all your due diligence and you're still just stumped, here are some answers. So let me first read the question. It says, I currently get pain that radiates down my left arm to my left hand. When this happens, I also get a radiating pain down my left leg at the same time. The pain is always down my left leg and left arm. When the pain occurs, it is always arm, hand, leg. When I get the pain, I often get terribly painful spasms in my left foot and left arm. I've suffered from this for over 20 years. I've been for MRI and CT scans, full body, including brain, 6 times over the 20 plus years, and nobody can find a problem. The pain happens for an hour, then completely goes away like it never happened for an hour. The duration of this pain varies every time. The pain comes and goes many times a day. I'd love to hear your thoughts on this. Thank you in advance. So something like this that has been going on for a long time and has been obviously checked out through MRIs and CTs is unlikely a lesion of the spinal cord or nervous system. But what can happen if you have pain on the same side of the body in the hand and leg is a sensitization of the spinal cord. Normally, the nerves to your hand and arm come out of your neck, and the nerves to your leg and foot come out of your lower back. So there shouldn't usually be a lot of crossover. But the two nerves do travel side by side through your spinal cord as they're ascending up into the brain. Pain and temperature and sharp, dull sensations travel through a part of your spinal cord known as the spinal thalamic tract. This is an image off of University of Minnesota's website that shows a really good illustration of it. I'll put the link to this in the description of the video. But your sensory information comes into the back part of your spine in a part called the dorsal horn. These are showing different levels of the spinal cord at S2 in the lower back, L3 in the lower back, T4 in the middle back, and C8 in the neck, and then the brain stem going up to the brain. You can see the sensory information in the spinal thalamic tract comes into the back part of the dorsal horn, then crosses over to the opposite side of the spinal cord. Then that information ascends up to the brain, and you can see that here at C8 it shows the cervical fibers, thoracic fibers, lumbar fibers, and sacral fibers. So they run side by side, but they still retain their original information. What can happen though, if you've had pain that's gone on for a long time, is you can get a sensitization or a spread of information. You can get information that starts projecting into other tracts, meaning that pathways between the cervical and lumbar tracts, for example, may start to overlap. And fibers that normally weren't activated beforehand, you may start getting communication between those two tracts. Now, there's usually a physical cause of this. It's not like you're making it all up or it's all in your head. It's usually a physical cause, but it may not necessarily be something that is harmful or damaging. In fact, pain is really your brain's way of understanding danger or possible danger and responding to it. So it's not necessarily a signal that comes from your body up, but it's your brain's response to that signal. But there is usually a signal. Now, when you have a painful stimuli that becomes more painful when things are sensitized in your spine, that's known as hyperalgesia. It means something that should be a little painful becomes a lot painful because the nervous system has gotten more sensitive. You can also have something called allodynia, which means something like a light touch that shouldn't normally be painful at all actually becomes painful. but that's because the pathways along the spinal cord have become more sensitive and information is flowing along that spinal thalamic tract at a higher than usual rate. And so by the time that information reaches your brain, it's no longer saying pinprick on my left finger. It might be saying pain on the entire left side of my body. Or if you turn your neck in a way that might slightly irritate you or just be perceived as some muscle tension, instead of seeing, oh, my neck's a little bit stiff, your brain sees pain on the entire left side of the body, or rather nociception, or the precursor to pain on the entire left side of the body. Now, the longer this has gone on, your brain starts to worry about the problem a little bit more. And the more worried your brain is, the more it asks your body to send it information. And so it actually makes your receptors in your spinal cord more sensitive to sending information up to the brain. So you get further sensitization, further expansion of the receptive field, where things start spreading and becomes worse and worse and worse. It becomes sort of a snowball effect. So how do you fix this type of problem? Well, it's not an easy answer and probably not one that I can answer in a video, but there are a few things to know. Number one, do your due diligence. Make sure that it's not actually a lesion or a problem with the nervous system. Now, if there was an injury to the spinal thalamic tract, you'd actually probably expect the opposite result, that rather than getting too much information going up, you'd lack pain, you'd lack temperature sensation, you'd lack the ability to distinguish between sharp and dull touch. But in this case, it's actually a sensitization or a facilitation of that spinal thalamic tract, meaning too much information is getting up to the brain. Now, fortunately, your brain does have the ability to shut off that information by cognitively telling yourself that I'm not worried about that. If you've done all your due diligence and you know that there's nothing wrong, if you perceive that sensation, you can use reframing, which is a technique of saying, yes, I'm aware of the sensation, but I know that there's no problem. I know there's no actual harm. This isn't going to magically fix everything overnight. You can't just sing Kumbaya and expect everything to go away. But what it does do is it starts to desensitize the nervous system. And if you repeat things like this over time, your nervous system gradually gets less and less and less sensitive. If you have an area that's particularly painful, for example, say your hand or your foot, and you touch it lightly and you get sharp pain in your hand, foot, and leg, just giving that some sensory input and giving yourself confirmation that I know this is just a towel rubbing my hand, that reassures you that there's no actual damage, and it dissociates that input of light touch from being something harmful or painful. So that was just a brief answer to a very complex question. But to summarize, if you are having pain on one side of the body and you've done your due diligence, made sure that there's not an anatomical finding on an MRI, it's probably likely that there's a sensitization of what's known as your spinal thalamic tract. And you can decrease that with some cognitive techniques like the ones I mentioned. I also do have a book called Chronic Pain. You're not just getting older, you're not crazy, and it's not all in your head. It goes more in depth into this information as to why you may be having chronic pain, as well as gives you some other cognitive techniques that can help, as well as some specific information for particular pain points like back pain, neck pain, knee pain, or facial pain. So hopefully you did find this video helpful. If you did, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.